Next, we have methods in epidemiology. Now, there are certain methods, like mostly the methods are characterized into descriptive, analytical, and experimental methods in epidemiology. Now, what is descriptive epidemiology? Descriptive epidemiology aims to outline how disease patterns vary across individuals or geographical locations or time periods, right? Means the answers, we what we get the answers, like what is the disease, who is getting the disease, where is the disease occurring, and when did it happen. So it identifies the patterns and trends in disease occurrence. Common tools are case reports and case series, cross-sectional studies, surveillance data, and mortality and morbidity statistics. So, for example, a study showing that dengue cases peak during monsoon season in urban slums of Delhi. So, this study, this line or this statement shows that who is being affected? The urban slums of Delhi, urban slums where in Delhi, and when is the monsoon season. So this statement gives you the groundwork for deeper investigation, highlighting the answers to who, where, and when. Next, we come to analytical epidemiology. Analytical epidemiology means we are covering the underlying causes and risk factors. Now, this epidemiological method answers the questions that why did it happen, how did it happen, right? And it also compares groups to identify association between exposure and outcome. Common study designs include case control studies, cohort studies, and ecological studies. Like, for example, if we take of this, a cohort study examining whether long term exposure to air pollution increases the risk of chronic bronchitis or not. So, we are trying to establish the causal relationship between the air pollution and the risk of chronic bronchitis, and this only guides us to have the preventive strategy to prevent the risk of chronic bronchitis in the people where they are having air pollution as the main concern of the environment. Next, we come to experimental epidemiology. It focuses on assessing the effectiveness of health interventions by applying them under controlled conditions. So now we are assessing the healthcare system of our society or of our country. So key features are that it is involving active manipulation of exposure and treatment. It uses control groups and it measures outcomes to assess the efficacy. Common designs include RCTs, that is randomized controlled trials, field trials, and community intervention studies. So now, for example, in this, if we talk of experimental studies, an RCT testing the efficacy of a new malarial vaccine in reducing incidence among children in endemic regions. So, what evidence are we having for casualty? That now this is essential for policy and clinical decision making also. That whether the malaria vaccine is efficient enough to reduce the incidence among children in endemic regions or not. So, here we saw that what are the differences between three, like descriptive, it is answering to the questions like what, who, where, and when. Analytical is answering like why and how. And experimental epidemiological method is answering to what works best for a certain type of disease. So examples, or you can say the designs of studies are surveillance reports, cross-sectional studies, case control cohort studies in analytical, and RCT field trials in case of experimental, right? So this was a gist, and this was a summary of what three methods are in epidemiology.